Thank you very much, Mr. Chairman, and thanks for all the witnesses, or to all of the witnesses for being here. This is a topic that is very important to us in the state of Missouri, where we have not only many hospitals, of course, but many rural hospitals, and there have been a number of major cyber attacks against hospitals in the state of Missouri. In September of 2021, for example, a ransomware group stole confidential patient information, which included names, social security numbers, and medical information from a health center in Sikeston, Missouri, which is in the southeast part of our state. In March of last year, it was reported that a hospital affiliated with the University of Missouri Health System experienced a cyber attack in which a third party gained data, sensitive patient data. And just a few months ago, a hospital based in Marshall, Missouri, found out that more than 112,000 individuals were affected by a data breach. So obviously, this is a very significant problem. And I'm also concerned about the interplay of foreign adversaries here like China, and I want to get to that in just a second. But Ms. Pierce, if I could just start with you and focusing in particular on rural hospitals. In Missouri, we have 67 hospitals classified as rural hospitals, including one in the town where I grew up. That's about 40% of the hospitals in my state. So we are a rural state, and proudly so, but I'm obviously very concerned about the threat that cyber attacks pose for rural hospitals in particular. And I wonder if, just building on the statements you made to Senator Hassan, can you give us a sense, what are the one or two most important steps that you think rural hospitals and rural healthcare facilities can take to shore up their cyber defenses?
Thank you for that question. I've had the pleasure of working with some hospitals from your state, and I can assure you that it's not for lack of wanting to address these issues. Part of the issue that I'm seeing across the board from not just Missouri but from other states is just a lack of funding, a lack of ability to be able to address the issues that they know about. Some of the things that they could do, I had included in my written statement, but top priorities would be they need to obviously have strong passwords. We've done a poor job at implementing strong passwords, and that's one of the areas where attackers are able to breach our networks. Another aspect that is important is being able to monitor our networks 24/7. Most small facilities have no staff to be able to monitor. So even if they have the tools for log management or for monitoring the endpoint devices, if nobody's watching the console and nobody's there to pick that up, then it could be hours, critical hours in a cyber attack before they even notice that somebody has gotten into their network.
Let me ask you about the urban-rural divide. How do you assess the current state of cybersecurity in rural hospitals versus urban? And what, if there is a disparity, as I imagine there is, to what do you attribute that? Is it funding? What are the factors there?
I would say from my experience, urban hospitals predominantly have staff within their facility. Some of them multiple staff that are addressing each area of the complex issue of cybersecurity. Smaller facilities, from my experience, they have seen most of them have no staff that are directly assigned to cyber, or they have very little staff in that area. So I think there's a huge disparity between them. What we need to know is that most small hospitals are connected to larger tertiary care centers. We need a place to refer our sicker patients. So this is the path of least resistance for our cyber attackers. When they're trying to figure out how to get to those big systems, they're coming in through our small hospitals. And we've seen that play out in 2022, where our small hospital is the avenue of least resistance. The cyber attackers attack there where they know the defenses are low and actually gain access to a plethora of information.
So is part of what needs to happen here these rural hospitals that are, as you say, are often part of larger hospital networks? I mean, do the larger at the network level, do we need to have more staff there that can perform the monitoring? Because I'm just thinking about the hospital in the town where I grew up, and It was very important. My little town was the county seat, it was the county hospital, but they didn't have excess staff. Not that it's excess to cybersecurity, but they didn't have a lot of staff. Let's put it that way. What staff they did have were treating patients. So which is exactly the scenario you described. So I'm trying to think about when we try to find a solution for these rural hospitals, we say you need to have staff that are devoted to cybersecurity. They're going to say, how in the world would we do that? So do we need the larger hospital networks who at the administrative level probably do have staff? Should they be the ones who are taking on this burden? I mean, what's the path forward here, do you think?
I think that we did allow, through the Stark Law changes, for larger facilities to assist smaller facilities with their cyber defense, and I think we saw absolutely no traction in that area. They were given some leeway to do that, and they have not extended those opportunities to small facilities. I believe that the answer would be to incentivize these facilities to secure their own networks, to ensure that they have access to some funds that will enable them to implement the security that they need to protect their networks.
Very good. Thank you for that. Mr. Dreesen, if I could just switch to you for a second. I want to talk about China. You write in the testimony you submitted about the increasing frequency of attacks from nation-state actors and organized crime. Just drilling in on China for a second, do you have any sense of the number and percentage of the attacks that we've seen recently, these cyber attacks that are committed by Chinese hackers?
I don't have specific details of the types of the sorts of attack from China versus Russia versus other countries. It's just significant in terms of the daily barrage we get and are repelling to help protect us.
What could the government do, the U.S. government be doing to help protect hospitals and healthcare systems from attacks by these nation-state actors, and particularly again given China, where we're seeing we've heard testimony in this committee before about the huge increase in cyber attacks across industries, but arguably none more important than the healthcare industry. What could the U.S. government be doing to help counter that?
Well, we need to take a whole team approach to solve this problem, where the hospitals and healthcare sector are the defensive side of that equation and that relationship, where we're defending our organizations, and then having the federal government bringing higher levels of risk and consequences to those who are attacking us. I think the recent example of the Hive being taken down is a great one to celebrate, a reduction of risk to our organizations, and so getting more aggressive like that to help protect the organizations, and then again helping to provide more actionable intelligence to the health sector in a real-time manner to allow us to be as able as possible to protect ourselves with the most current threat information that the government has access to.
Thank you, Senator Hawley.